Congratulations! Your Midmark 1000 mobile dental delivery system has arrived. In this video, we'll show you how to properly unbox your Midmark 1000 and set up your unit. First, do not attempt to move the Midmark 1000 unit while it is on the pallet. It weighs over 160 pounds. Attempting to move or slide the pallet could scratch your floor. On delivery, have the pallet placed in an area where you will have room to comfortably unbox the unit. Leave it there until you are ready to open the box and get started. The first step in unpacking your Midmark 1000 is to carefully cut the outer strapping and lift the cardboard cover up and off the dental unit. Next, cut the tape holding the two large pieces of cardboard together and remove that along with the plastic covering. Once the package has been removed, you will find a flat, white box containing accessories and a brown cardboard box that contains the Handpiece Conditioning spray. On top of the unit will be the instrument tray and user's guide. Inside the back of the dental unit will be the high and low speed handpieces, swivel adapter, and power cord. Take all items out and set them aside in a safe location until you are ready to continue the setup. At this point, it is important to have a second person help you lift the Midmark 1000 off the pallet. Carefully lift the unit straight up and securely place all four wheels on the floor. The air-water syringe is already assembled. It is in the yellow package. Remove the air-water syringe from its packaging and place it in the fourth holder labeled syringe. Next, take the foot pedal out of its box and place it on top of the dental unit until ready to use. Now let's focus on the back of your Midmark 1000. Plug the power cord into the back of the unit. The power cord is designed to attach loosely to the unit in the event the power needs to be quickly disengaged. Above the power cord is the on-off switch. Flip the switch up to power the unit on and down to power it off. Below the on-off switch are the two breakers for the dental unit. If either breaker trips, it will flip down and show as white. A breaker may trip when there are too many pieces of equipment running on the same circuit. To reset a tripped breaker, flip the breaker back up. A handle is located at the top of the unit. Use the handle whenever moving the unit. Just below the handle are external water and air quick disconnects. The blue connection on the right can run an external water line for a secondary scaler. The red connection on the left can pull air from the unit's compressor for additional equipment. Inside the back door of the unit, there is the air storage tank and air regulator. Tubing runs from the bottom of the air tank to the back door of the unit, with a valve that can be used for venting at the end of the day. On the back of the door, there is a pouch that holds your Midmark 1000 operating and care guide. Please reference this for any questions you may have. Now let's go over the front of your Midmark 1000. The faceplate is labeled to indicate the position of each handpiece. The blue knobs are the water controls for the handpieces, and they correspond to each handpiece from left to right. Turn the knobs counterclockwise to increase water output and clockwise to decrease water output. The metal knobs are for drive air adjustment. These are factory preset, but to adjust the PSI recommended for each handpiece, use a small flathead screwdriver to slowly turn the knob counterclockwise to increase air output and clockwise to decrease air output. To the right of the blue knobs is the multicolor scaler intensity dial. This is used to set the correct range of frequency for your scaler, depending on which tip you are using. We will come back to this later in the tutorial. Beneath the handpiece holders are two water bottles. Midmark recommends using distilled water in your Midmark 1000 mobile dental delivery unit. Fill each water bottle with distilled water to the line above the logo. To insert the water bottle onto the unit, apply upward pressure and turn to tighten. The toggle switch between the water bottles controls which bottle will supply the water. When the toggle switch is in the center, neither water bottle is pressurized. Toggle the switch to the left to use the left bottle. Toggle it to the right to use the right bottle. Toggling to the other depressurized bottle or the middle neutral position allows one bottle to be removed and refilled during a procedure without interrupting or losing the stored air. Before we attach the handpieces to the dental unit, we will go over each of the accessories that come with your unit. First, we have the accessory tray. Remove the tray from its sleeve and place it on top of the dental unit. You will also receive an envelope with the user's guide, 2 sample client-facing brochures, warranty information, and accessory information. Store the documentation in a safe, dry place. Next, we have the conditioning spray, the spray bottle, and red straws that are used to condition your handpieces. Moving on to the handpieces, we'll start with the high speed. Inside the box is the handpiece, blank burr, and instructions for use. Swivel conditioning nozzle, chuck conditioning nozzle, water port cleaning tool, diffuser wrench. We will go through how to use these tools later, but it is important to keep them all stored in the handpiece box to avoid losing them. Next, we will open the high-speed swivel adapter box. This adapter screws into the unit's high-speed line. Included in this box are the swivel adapter wrench and replacement O-rings. Keep the wrench and spare O-rings in the box to avoid losing them. In the low-speed handpiece box, you will find the low-speed handpiece and its instructions for use. Keep the box in a safe place. The flat white box includes the largest number of accessories. You will find the Piezo Scaler handpiece, autoclavable plastic box, 3 scaler tip wrenches, 3 scaler tips, scaler tip wear guide, starter burr kit, Profi angles, and instructions for use. Save the boxes and keep them in a safe place to store your extra accessories and the scaler tip wear guide. Now we will cover what is included in the smaller boxes. In the small white box are the 3 scaler tips and the scaler tip wear guide. The 3 small cube boxes hold the scaler wrenches. You can put them in the autoclavable plastic box. Lastly, the thin Action box holds your scaler, instructions for use, and O-ring replacement kit. Now that you are familiar with what comes in each accessory box, we will show you how to set up your handpieces. But first, let's go over the foot pedal. Remove the plastic covering from the foot pedal and place the foot pedal on the floor to use it. A handpiece is activated once it is removed from its holder. To activate a handpiece properly, you must press the foot pedal all the way down. Without adequate pressure on the foot pedal, the handpiece may not operate at the proper RPM range. To attach the high-speed handpiece to the unit, you will first need the swivel adapter and the swivel adapter wrench. Insert the swivel adapter into the coupler, ensuring it is going into the correct holes. Grasp the long end of the swivel adapter and hand tighten the coupler. Use the wrench to tighten the adapter until snug. Do not over-tighten the coupler. The swivel adapter does not need to be flush with the coupler. Insert the end of the swivel adapter into the open end of the high-speed handpiece and push until it clicks into place. Once it is attached, insert the blank burr. To properly seat a burr, insert it into the chuck until it stops. Center your finger on the button. Press Then push the burr until it is fully seated in the chuck. Tug back on the burr to ensure it is properly seated. Lift the high-speed handpiece from the holder. Turn the water off and press down on the foot pedal to verify the PSI is set between 32 and 40, and adjust as needed. Using the blue water knob on the left, adjust the water to a fine mist. To avoid damage to the turbine, never run a high-speed handpiece without a burr. Next, to attach the low-speed handpiece to the unit, first ensure the middle blue water knob is off. Insert the low-speed handpiece into the correct size holes. Tighten the coupler to the handpiece, but do not over-tighten, as the handpiece and coupler should not be flush. Next, attach a profi angle to the handpiece. Turn the locking ring near the top of the handpiece to the unlock position. Insert the profi angle into the low speed, lining up the notch on the profi angle with the bump on the tip of the low speed. Once the profi angle is fully seated, twist the locking ring back to the locked position to hold the profi angle in place. Lastly, lift the low-speed handpiece from the holder and press down on the foot pedal to verify the PSI is set between 35 and 50. Adjust PSI as needed. To connect the Piezo Scaler, line up the dot on the handpiece with the dot on the coupler on the line. Push until the handpiece is fully seated on the line. Do not twist the handpiece once it is fully seated on the line. Twisting the handpiece could break internal components. To attach a tip to your scaler, you will need a scaler wrench. There will be one wrench for each provided scaler tip. You will notice a colored band on the scaler tip. Make sure the scaler power setting on the dental unit is set to the same color. All the scaler tips included with your Midmark 1000 dental unit always run in the blue section of the power dial. Load all the tips into the wrenches and leave them accessible on the work surface. Use the guide on the side of the wrench to insert the tip into each wrench. Screw the tip into the scaler clockwise until the gray center of the wrench stops turning. Your scaler tip is now fully tightened. Lastly, to ensure the scaler is set to the correct water setting, turn the water and power dial all the way down. Turn the water up first until it is a fast drip. Then turn the power dial to the desired setting in the blue section. This should produce a nice halo. One of the most common ways to damage your Piezo Scaler is to have it catch on clothing, pull off the holder, and fall to the floor. The autoclavable plastic box has a built-in section made for the scaler. Between procedures or at the end of the day, take the scaler off the unit and place it in this section to help avoid damage. The air and water syringe comes assembled on the unit. To use the air and water syringe, lift it from the holder. For water, press the left button. For air, press the right button. For a mist, press both buttons together. Now we will go over how to condition your handpieces. Use the blank burr to condition your high-speed handpiece for the first time. To condition the handpiece, attach the swivel nozzle to a well-shaken can of conditioner. Push the conditioner nozzle into the open end of the handpiece until it clicks. Hold the handpiece over a towel and depress the conditioner spray for a few seconds, or until lubricant is present on the end of the burr. Next, remove the blank burr by lightly pulling outward on the burr. Center your thumb on the push button and apply inward pressure. Set the blank burr to the side for a moment. Now attach the chuck conditioner nozzle to the can of conditioner. Insert the tip of the conditioner nozzle into the chuck of the handpiece until it is fully seated. Hold the head of the handpiece over a towel, then depress the can of conditioner for a few seconds, or until the conditioner comes out of the head cap. Wipe down the handpiece and head cap with a towel. When your high-speed handpiece is reconnected, turn the blue water knob off and depress the foot pedal for 45 seconds to expel any excess conditioner. Once completed, adjust the water until it becomes a fine mist. If you have purchased a high-speed handpiece without swivel, instead of using the swivel nozzle on the can of conditioning spray, you will use one of the red straws inserted into the smaller of the two large holes at the end of the handpiece. Follow the rest of the conditioning instructions. Your low-speed handpiece should be conditioned daily to prevent diminished performance. To condition your low-speed handpiece, insert the red straw into the can of well-shaken conditioning spray. Insert the red straw into the smaller of the two holes until it is fully seated. Hold the handpiece over a towel and depress the can of conditioner for a few seconds, or until conditioner comes out of the end of the handpiece. Wipe down the handpiece with a towel. When your low-speed handpiece is reconnected, make sure the blue water knob is off. Depress the foot pedal for approximately 45 seconds to expel excess conditioner. Your Midmark 1000 mobile dental delivery system is now completely unpackaged and ready for use. Be careful throwing away packaging from your new dental unit. Double check to make sure you aren't throwing away parts, accessories, or user documents. Keep all accessory packaging for storage of extra parts, user's guide, and other documentation for reference. If you have any questions, reference the included Midmark 1000 user's guide or call Midmark Technical Support or Customer Experience at 1-800-MIDMARK. The next step in practicing dentistry at the highest level in your clinic is whole team training. Visit midmarkacademy.com for over 80 hours of RACE-approved clinical training, including a 2-day in-clinic best practices workshop, or contact Midmark Academy at midmarkacademy@midmark.com for more information.